Whenever a child of CTV arrives to you, the first thing is examine that whether the child is syndromic or not. Syndromic means you apply plaster in this child and he won't respond. So you have to understand what are the syndromes that with CTV, Poon belly syndrome, Streeter syndrome, Down syndrome, cerebral palsy, all these are syndromic child. So what are the things which I see? First, about the birth history I ask. Next, I see there is a band over here. There is nothing over here. But if there is a band, that is called constriction band, then the child is a syndromic child. I make the child back and search for meningocele pouch over here, spina bifida, tough hair at the back, at the potty place. If I see all these are normal, then I can tell that yes, this child can be treated by CTEV, Ponseti technique. Ponseti technique of serial clustering is based on assessment of the child every time I open the foot. What assessment? I take the foot like this and then I calculate points. What points are there? First, talar head. If you touch this bone, you can feel the head of the talus. This is a bone. You can feel the head of the talus. Talar head prominence, right? Number one. Number two, if I see the lateral border of the foot, if the lateral border of the foot I see, then it is curved inward, right? It is curved inward. So there is inward curvature of the lateral border of the foot, talar head prominence, and if you come medially, you will see a deep medial crease. The child is not allowing. You see there is a deep medial crease. So there are 3 points upon the forefoot side. 3 points. Lateral curvature, talar head, deep medial crease. All these Pirani has scored 1 point if it is very prominent. It is very prominent, 1 point. Partially lossable, 0.5. You can't feel talar head, score is 0. So 3 score the child gets over here. Now I come to the posterior edge of the foot. Posteriorly what? Empty heel sign. Feel? It is empty. If you feel it something, you feel the head of the calcaneum inside. Now you are feeling nothing. It's empty heel sign. The other thing is rigid equinus. The equinus is rigid. You can see this foot is not moving. Done. This foot is not moving. There is rigidity of the equinus. And there is a deep posterior crease. So 6 points. Out of 6, any child who gets a score of more than 3 will definitely land in an operative treatment by tenodecal stenotomy. So I told them that 90% of the child won't need operative treatment. This child will land in tenotomy. 10% of the child will land in tenotomy. So I can score कि इसका आगे क्या prognosis होने वाला. I can tell from here on what next.